Have you ever wondered whether your child or even yourself may have autism or the features of autism? Do you know of someone or someone's child who has been diagnosed with autism? Are you looking to find out about the basics of autism, what it actually is, what are the key signs, and what we can do to support someone with autism? Then keep listening as we cover all of these in this animated summary. Hi, welcome back to the channel. My name is Dr. Aziz. I'm a psychology graduate of Cambridge University and also a medical doctor. In this video, I'll be covering autism. We'll be covering what causes autism, at which age this can occur, what are the typical signs and symptoms, and most importantly, what you can do about it. The definition of autism. First and foremost, what is autism? The Oxford Medical Dictionary defines autism as a developmental disorder of variable severity that is characterized by difficulty in social interaction and communication and by restricted or repetitive patterns of thought and behavior. So what causes autism? Nobody knows what causes autism or if it indeed has a specific cause. It can affect people in the same family, so it may sometimes be passed on to a child by their parents, i.e. there may be a genetic component, but we don't know for sure. What we do know, however, is that autism is not caused by bad parenting, vaccines such as the MMR vaccine, diet, or an infection. We also know that autism cannot be spread from one person to another. Signs of autism. So what are the signs of autism? Classically, there was talk of the triad of signs of autism: impairment of social imagination, impairment of social interaction, and impairment of social communication or rigidity. More recently, the DSM-5, the major diagnostic criteria used by psychiatrists to arrive at formal diagnoses, introduced a dyad of impairments. A dyad means something that consists of two things. This dyad consists of, number one, impairment of social communication and interaction, and secondly, of restrictive, repetitive patterns of behavior. That's all good and well, but in practice, what are some real everyday signs and examples of these impairments? We can divide these into two broad categories depending on the age of the children. Signs of autism in young children include not responding to their name, avoiding eye contact, not smiling when you smile at them, getting very upset if they do not like a certain taste, smell, or sound, repetitive movements such as flapping their hands, flicking their fingers, or rocking their body, not talking as much as other children, or repeating the same phrases. Signs of autism in older children include not seeming to understand what others are thinking or feeling, finding it hard to say how they feel, liking a strict daily routine and getting very upset if it changes, having a very keen interest in certain subjects or activities, getting very upset if you ask them to do something, finding it hard to make friends or preferring to be on their own, taking things very literally. For example, they may not understand phrases like break a leg. Autism diagnosis. So how does one get diagnosed? If you feel your child has symptoms of autism, then discuss this with your health visitor or GP, or in America, family doctor. They can then do a referral to a specialist, usually a pediatric psychiatrist who can carry out the necessary assessment. Being assessed by a specialist is the only way to get diagnosed with autism, or in fact to rule it out. Treatment of autism. There is no one standard treatment of autism, and most treatment of autism centers around behavioral support and therapies such as CBT. For those struggling with language and communication issues, speech and language therapy can be very helpful. Prognosis of autism. There is no cure of autism, unfortunately, and if someone is diagnosed with autism, they will likely have it for life. However, having autism does not mean that you or your child cannot live a fulfilled life. Although autism only became a formal diagnosis in 1943, many experts have speculated, based on their biographies, that amazing individuals such as Mozart, Isaac Newton, and even Albert Einstein may all have had autism. No one is perfect in this life, but we can all have a perfect go at living our best lives possible, both for ourselves and our children. Now, I mentioned earlier that autism is not caused by the MMR vaccine. You may have heard this before, vaccines and in particular MMR vaccines being linked with autism. And if you're wondering where this scandal or idea ever came from, then watch this video where we cover the 3 fraudulent individuals who try to make huge amounts of money by propagating this false theory. Anyway, I hope you learned something useful and enjoyed this summary. If you want to keep learning about psychology, medicine, or life hacks, hit the like, subscribe, and notifications button below. Any suggestions or comments, feel free to post down below. Until next time, stay safe.